Principles of antimicrobial therapy. Abstract. On completion of this topic, you should be able to define chemotherapeutic agents, antibiotics, and antimicrobial drugs. Explain selective toxicity with reference to antimicrobial therapy. Explain the important mechanisms of action of antimicrobials. Differentiate between bactericidal drugs and bacteriostatic drugs. Discuss resistance to antimicrobials. List the conditions of empirical use and prophylactic use of drugs. Rationalize drug combinations. Differentiate concentration-dependent kinetics, post-antibiotic effect, and time-dependent kinetics of drugs with examples. Chemotherapeutic antibiotics, antimicrobial agents. Chemotherapeutic agents. 1. Refer to drugs that specifically target and kill or inhibit the growth of microorganisms, such as bacteria, viruses, fungi, and parasites. 2. To treat various diseases, including cancer and infections. Antibiotics. Antibiotics are a specific class of antimicrobial drugs that are effective against bacteria. They are substances produced by microorganisms or synthetically manufactured. Antimicrobial agent, AMA. Antimicrobial drugs are a broader category that includes antibiotics as well as antiviral, antifungal, and antiparasitic drugs. Department of Pharmacology. Associate Professor. ING outcomes. Selective toxicity. Microbial cells, such as bacteria, fungi, viruses, and parasites, have structural or functional differences compared to human cells. Drugs effectively target and eliminate microbial pathogens and not harm humans. For example, penicillin target bacterial cell walls, a structure absent in human cells. Inhibits cell wall synthesis. Penicillins, cephalosporins cause leakage from cell membranes. Bacitracin, amphotericin B inhibit protein synthesis. Tetracyclines, chloramphenicol, aminoglycosides, streptomycin, macrolides. Inhibit DNA gyrase. Fluoroquinolones, for example. Ciprofloxacin interfere with DNA function. Rifampin, metronidazole. Interfere with intermediary metabolism. Sulfonamides. Trimethoprim. Important mechanisms of action of antimicrobials. Inhibition of cell wall synthesis. Examples: penicillins, cephalosporins, vancomycin. Human cells do not have cell walls, selectively toxic to bacteria. Inhibition of protein synthesis. Examples: aminoglycosides, tetracyclines, macrolides. Human ribosomes are different in structure to microbes, so drug exhibit selective toxicity. Important mechanisms of action of antimicrobials. Inhibition of nucleic acid synthesis. Examples: quinolones, rifampin. Human cells have different processes for nucleic acid synthesis, contributing to selective toxicity. Inhibition of metabolic pathways. Examples: sulfonamides, trimethoprim. These drugs interfere with specific metabolic pathways essential for microbial growth. Introduction. Broad categories of antibiotics. Bactericidal drugs and bacteriostatic drugs. Bacteriostatic drugs. Bacteriostatic drugs agents arrest the growth or replication of the microorganism, but cannot kill them. Limit the spread of infection while the body's immune system eliminates the pathogens. Bactericidal drugs *, the agents which can kill the microorganisms are called bactericidal drugs. *, it should be noted that a drug may be bacteriostatic for one organism, but bactericidal for another. *, for example, chloramphenicol is static against GM rods and is cidal against other organisms. Bactericidal agents, penicillin and cephalosporins aminoglycosides, gentamicin, vancomycin, rifampicin, metronidazole. Bacteriostatic agents, tetracycline, sulfonamides, macrolides, both bactericidal and bacteriostatic, chloramphenicol and metronidazole. Terms used in the lecture. Minimum inhibitory concentration, MIC. Asterisk, the lowest concentration of antibiotic that inhibits bacterial growth asterisk to provide effective antimicrobial therapy. The clinically obtainable antibiotic concentration in body fluids should be greater than the MIC. Minimum bactericidal concentration, MBC. Asterisk, the minimum concentration of antibiotic that kills the bacteria asterisk is the lowest concentration of AMA that results in a 99.9% decline in colony count after overnight incubation. Ideal antimicrobial agent. Asterisk, inexpensive asterisk, fast-acting asterisk, stable in storage asterisk, soluble in body fluids. Asterisk, does not cause allergy asterisk, does not cause resistance asterisk, acts on microbial growth, but doesn't harm humans asterisk. There is no ideal antimicrobial drug. Resistance. An adaptive response in which microorganisms begin to tolerate an amount of drug that would ordinarily be inhibitory asterisk, 1 enzymic inactivation. The antimicrobial agents can cause resistance on microorganisms. For example, beta-lactamases destroy many penicillins and cephalosporins. Asterisk 2. Modification of target sites. The beta-lactams can resist to organism by alteration of the target site, that is penicillin binding protein PBP. Asterisk. Mutation of dihydrofolate reductase, which is less sensitivity to inhibition in organism resistant to trimethoprim, alteration of metabolic pathway. 3. Decreased accumulation. Asterisk, antibiotics are unable to gain access to due to the presence of an efflux system that pumps out the drug. 4. Decreased permeability. Another situation is that gram-negative bacteria show a special membrane lipopolysaccharide layer and decreased penetrability of antibiotics. The site of action. Genetic alterations leading to drug resistance. Mutations. Specific genetic mutations are the molecular basis for resistance to streptomycin ribosomal mutation, to quinolone's DNA gyrase gene mutation, and to rifampin RNA polymerase gene mutation. It is commonly employed in situations where a rapid treatment response is crucial. Nephrotoxicity, amphotericin B, aminoglycosides, vancomycin. Hepatotoxicity, erythromycin, isoniazid, rifampin. Neurologic disorders, aminoglycosides, ethambutol, isoniazid. Myelosuppression, chloramphenicol, macrolides, teratogenity, aminoglycosides, quinolones. Time-dependent inhibition beta-lactams. Asterisk, antimicrobial action depends on the length of time the concentration remains above MIC. Asterisk, division of daily dose has better effect. Concentration-dependent inhibition asterisk, some drugs, gentamicins, fluoroquinolones, cause a significant increase in the rate of bacterial killing as the concentration increases asterisk produces better action when given a single dose than if the same dose is divided into 2 to 3 portions. Post-antibiotic effect, persistent suppression of microbial growth that occurs after levels of AMA have fallen below MIC. Antimicrobials exhibiting a long several hours require only 1 dose per day, e.g. aminoglycosides and fluoroquinolones. Thank you.